What's good, everybody? Sherman Webb Middlebrooks, a lifelong Buffalo resident and full-time black man. And man, I am here with a very special series, and we got our very first guest of the Open Buffalo Emerging Leaders Alumni Spotlight. Okay, we are going to be shedding light on 10 of Open Buffalo's Emerging Leaders alumni to celebrate the 10th year of the program. And I have a very special guest with us here today, our first interviewee in the series. I've taken the liberty to draw up a nice introduction for her. So if you wouldn't mind indulging me as we welcome you all to this very first episode. Our guest today is none other than Melissa Spikes Archer, a powerhouse in the healthcare field with over 20 years of experience serving in the Buffalo community. Melissa is a psychiatric mental health nurse practitioner. Okay, say that 3 times fast. Yeah. Psychiatric mental health nurse practitioner, a fierce advocate for practicing self-care, the co-founder of the Black Women's Wellness Village, where she empowers individuals and families to live healthier lives. She is also the new project director for the RECAST grant from the New York State Office of Mental Health, Western New York Field Office. She got a lot going on, okay? Her leadership extends far beyond the clinic, though. So she out here in the streets and in the clinic putting in the work. She serves on multiple boards, including the Epic Crisis Services and Mental Health Advocates of Western New York, and on the Open Buffalo Emerging Leaders Advisory Board, which is dope. That's kind of full circle being here. Yeah. She is also a proud recipient of the Black Achievers Award, the Distinguished TroCare Alumni Award, and the NAACP Presidential Award. And here's something incredible. She recently saved her husband's life thanks to a CPR training, which we will be talking about with the New York State Office of Mental Health.
Okay, so I'm about 3-4 weeks in.
Okay.
And, you know, with the top shooting, 5/14/2022, there was a lot of influx of how can we support our community getting through this, you know, catastrophic event?
Right.
How can we support them mentally and emotionally so that, you know, they can get through this trauma that we collectively experienced? So first it was the Surge grant. And then it was the Reimagine I Am the Dream, and now it's the RECAST grant.
Okay.
And they, the funding that comes into play is federal funding, but the funding that comes into play is given to organizations, individuals to provide, if you will, like non-traditional ways of healing.
Right.
Also, there's organizations that are providing clinical services in the Buffalo Public Schools, you know, just trying to provide mental health services, whether it's doing a clinical consultation or we're doing a mommy and me session or a yoga session or something like that. But the biggest divide of, you know, why these things can't be offered is usually funding. So This is a great opportunity that is provided to our community members to help heal ourselves.
Awesome.
Mm-hmm.
So talk to me about Black Women's Wellness Village. What inspired you to co-found it, and how has it impacted our community so far?
So I co-founded it with some amazing women, Brenda McDuffie.
Oh, wow. Okay.
Yes. I have to. Dr. Willa Arnett.
Okay, cool.
And she's a nurse practitioner. She's opened up a practice on Kensington, too. Holly Cerconi.
Ooh.
And Roberta Rifkin.
Okay.
So it literally just came about. We were in the backyard of one of these lovely women, and we're just chatting about, talking about the maternal health of Black women.
Right.
We know where it's at and how dire it is right now. And it's like, what can we do, not just with the maternal health, but what can we do to fill the gap? Because that's the whole thing about working in community. It's like, especially if you've gotten out of, we are required, I like how you said, we're required to give back and help others see the same, light that we've seen if they choose to. They can't do what they don't know.
Right.
So it's like, we're going to give you everything that you need, and then you can decide from there, and we'll give you all the supports. You just got to show up. So, the conversation just started, and it just kind of steamrolled from there. So not just helping women from a mental health, physical health, but financial, how to get employment ready, how to, get a home, all these different things that are barriers to women in terms of finding the best versions of themselves and getting to a space where they can be who they want to be. Recently, my husband, had a
yes, that was
incident.
That was next. So I'm glad you took me right to it. It was next.
Yeah, he had an incident where he was hospitalized, and he's never been inpatient, and he was like. One night we had to leave him because we were so exhausted. We left him, and coming back in the morning, and he had mentioned how, like, if you feel so vulnerable, because he said anybody can come in the room, you're in there by yourself.
Wow.
And I was like, yeah, this is what patients go through.
Wow.
And he's an excellent provider.
Yes, he is.
He said this has made him an even better provider. Just understanding, and he's
more mindful.
Yeah, more mindful, more like, you're sitting in the chair, you're sitting on the table, I'm examining you, but I know how it feels to be on the other end now. Because before he was just, when he goes to his doctor, it's just an annual physical, but this was a big event. His heart stopped. And so now there's a lot of follow-up. There's a lot of
more doctor's appointments.
Yeah. So, just seeing that part of it, it's just like, I'm like, so that was a lesson. That was the lesson. There's a lesson in everything, and I'm sure there's many more because we're learning them every single day, because it's only been 5 months that he has been home, that he's been, brought him back alive at home, and he's working, he's back at work, he's doing everything great. It was 5 months yesterday.
Wow. And it was crazy. We were saying before we started recording, because I didn't know.
Yeah.
And so, like, I have a short list of some of my favorite couples in Buffalo.
Aww.
So St. Ville's, y'all definitely on there. Kristen Noel, y'all on there. St. Ville's, but you and Fred definitely are on my short list of, like, someone in the YJs.
I love them.
Very short list of, like, just people who I just love to see them in love. I just love to see it, and you and good brother Fred are most definitely on that list.
Yeah, fun.
Yeah,
dance.
Yeah, like, and seeing y'all together, and y'all being, like, so, like, youthful, and, like, seeing that brother. I wasn't there when y'all first met. But seeing that brother look at you still, how I imagine how he looked at you when y'all first met.
You want to know how we met?
Sure.
I think I was a fairly new nurse, probably under a year, and he was a resident. We met at Children's.
Okay.
And he tells the story of when he saw me in the ER. I don't remember that.
He was watching.
Yeah, but when we really, really met, there was a kid that, it's funny because, like, I had to do CPR to save him, but there was a kid that had coded, and we saved this kid together. So it was kind of funny how things happen. Right?
Wow.
I still remember the room in 1019 at Children's, and this kid coded, and it was pretty bad, and we saved the kid. And I was working on the floor, got the kid to the ICU, and he had joked during the code. Excuse me. And I think I was the charge nurse. Very serious. I was in the military. I was very, and I think I said something to him that, like, aren't you ever serious? I was like, we do not joke during a code. And I didn't even know who he was. It was just like, all I know, because he was a first year, I think, intern.
Okay.
So, he wasn't the one calling the shots.
Right. He was there to learn.
Yeah. The attending was at the top of the bed calling the shots, and we're all doing what we're told, but we know what to do. But he's running the code, and Fred cracked a joke, and I was like, what? Oh. Yeah, I said Fred cracked a joke, and I was like, what are you doing? I said, no, this is afterwards. So I after like 10 minutes or so went by, after a code, thank God we saved this child, but it's like it is such an adrenaline rush, let down, and you got to deal with your own stuff. But guess what? You still got patience.
Yeah,
you got to keep it going. So he came to me like 10, 15 minutes later and was like, yes, I can be serious, and gave me like this little soliloquy of how he can be serious. And I realized, I was like, oh, did I offend you? I was so like, just.
You had moved on.
Yeah, I was like, what is this about? And I was like, oh my God, I'm so sorry. Because I was like, I don't want to offend anybody. It's just, that was just not the norm. Like, but what he taught me, he was like, I use humor to lower the temperature. Because this kid, I think this particular kid had coded, this was like their second time they had coded on the floor. And I don't know, the ICU was too busy or whatever, but then after to say, we were like, she has to go down. Like, this is the second time. Like, we just, and, so of course everything is up here, everybody, on high alert. And so he uses humor to kind of chill things out. And over the years, I mean, we've been together for 20, almost 30 years.
That's what's up.
And I'm like, wait a minute. Oh my God. And I've learned to add a little bit more humor. In fact, I probably really goofy, but add a little bit more humor. I'm always about lowering the temperature of the everyday grind. That's like one of my sayings. And I definitely learned that from him.
That's what's up. Yeah, it was a blast facilitating nurturing fathers with him. And I'm like, usually I'm the one trying to crack jokes. usually I'm the one, but you know what? I'm gonna just be the straight man and set him up for the punchlines. I'm gonna just toss him alley-oops. I'm gonna be Dwayne, and I'm gonna just toss him. I'm gonna just let him be LeBron. I'm gonna just toss him alley-oops because I'm like, he get on this Zoom call because also like he was busy, so he was taking time from what he was doing to step aside for 2 hours. Well, I think he was still seeing patients, but he would take 2 hours. It'd be sometimes he would have to join later because he would be talking with patients or in the meeting. So like I would kind of like steer and make sure that we hit our talking points and kind of make it so like, all you gotta do is show up and be you, Fred. So that's all we need you to do. Just I'll be the serious one and make sure that we stay on task and get through the slides. Like, I just want you to show up and be you because it has to be that balance.
Right.
It has to, and that's why I like sports shows. So like,
there's always I
watch Inside the NBA. They have the best chemistry. So like you get Shaq and Kenny and Charles Barkley. They get to be free, but then Ernie keeps it cool. Ernie steers the ship.
Somebody has to do it.
And so sometimes I'm like, okay, do I need to be Charles and Shaq? Or do I need to show them? Do I need to be Ernie?
Adaptable.
Yeah. So like,
you're a chameleon. You're like, okay, how is this going right now?
What role isn't being filled?
That's right.
What do I need to play so we can win? How do I make the team win? I think a lot of people, I don't know, could benefit from maybe taking that. I think it's, I don't know.
That's a podcast right there.
Yeah, it's kind of served me well in life. It's been some of the best advice that I can probably give somebody.
Yeah. What role you need to fill so we can win. I love that. So
we on a team. Like, we don't need another me. You know what I'm saying? Like, I don't want another me. Right. I can do this. I want to be around people who are great at and more so interested in things that I'm not. Because then I can learn from them. Because I probably ain't going to never put the time, effort, and energy into studying and getting the experience that you have in this field. But if I sit down and talk with you and build with you and connect with you, I can learn vicariously through you.
That's right.
And then you can learn vicariously through me.
Right.
And then now I can walk off and then I might be able to give the wisdom that you gave to me to somebody else without them having to go through it, without me having to go through it. But it's all because we talked, we communicated and connected as humans.
That's right.
And shared our human experiences. And I think that's what, as I get older, I'm starting to learn. I have a passion for that. And I think it's been very beneficial to my mental health. But I think creating these spaces where it's the new normal for other men and just people in general.
I'm so glad you said that.
Yeah, to just talk and connect and build relationships,
build community. they know they have a village, they can depend on.
Yeah.
You're not on an island by yourself, because that's a big thing that a lot of people kind of struggle with. They suffer in silence because they are ashamed or guilty. They feel guilty that, and it's like, no.
Ask a man that's over traditional college years. What's that, 22, maybe 25?
Yeah.
Ask them when the last time they made a friend.
Especially with social media and all that.
When the last time they made a friend? And you were sharing about saving Brother Fred.
Yeah.
Like, as you were sharing that story before we started recording, I was thinking like, oh, I'm a bachelor.
Yes, you did mention.
Like, I live alone. So the brother is lucky to have an amazing wife, first of all, but also a wife who knows what to do, because you're a medical professional, and you weren't panicking. You knew what to do in that moment.
Well, no, I'm requesting the 911 call.
Okay.
Because we're like, we have all these new family members now. The 911 dispatchers, the fire department, police department, and twin ambulance. Like, we made friends. We threw a party for them. We're inviting them to all the meetings. We're about to start having all these meetings to start planning summer activities. I was hysterical. Because I was screaming and yelling, but I did the work.
Right.
No, my body, it was like muscle memory. It's like, oh my God, but it was like, because I think very fast, I move very fast.
Yeah.
But I saw everything from, the funeral. I saw my son, 13-year-old boy, not having his dad. I saw the girls not having their, I saw all of that in that time.
In that moment process.
And I was like, and then I got angry. I was like, oh, no, you ain't going nowhere. I said, no, devil, you ain't going nowhere. I'm like, I saw me without him. So it was just like his mother who just turned 90 without him. Like, it was just like, what does that even look like?
Yeah. And
at our party, and it was like, somebody had said it, and then I just echoed it. It was like peanut butter without jelly. What does that even look like? When you're used to peanut butter and jelly for almost 3 decades. What does that look? I'm like, I don't even know. What does that look like? So it was like, no, you're coming back. But I was screaming because I was, wake up. Because, like I said, I talked to the 911 dispatcher when I first met him. I gave him a hug. I said, I'm so sorry. Because I kind of was like, I told him I teach CPR. I'm a nurse practitioner. My husband is dead and he's had a cardiac arrest. There is no pulse. And this is the address, and come. And he was still talking to me. And I was like, you're inefficient. I was out of control. Like, get here.
Yeah, like, this better be like in the movies.
Like, and that's why, like, we really want to push. Like, part of Fred's healing is, while he was even in the hospital, he was like, we got to do something. We have to. I don't want anybody else to go through this. I'm like, it's day 3.
You already trying to eradicate cardiac arrest.
Yeah, I'm like, we don't even know, like, what's coming after this. But that just shows the heart. That just shows like, even with your last whatever, you got to give back, right? And that shows his commitment. So, commitment to community, commitment to fathers, commitment to mothers, to children, to just any human being. So part of his healing journey is like, we made a foundation. We kind of partnered with Channel 2.
We're doing
a lot of stuff. So
talk to us a little bit about like the CPR. You teaching classes? We just did one with some Boy Scouts. So Fred has all the details, but we just did one with Boy Scouts. We did one at our kids' school. And middle schoolers and kids are a lot of fun because it's a big party. But just teaching them that. But we want to get things more formalized where we have like American Heart Association. We've been talking with them. Zoll, we've been talking with them. And just different entities. We're going to try to bring everybody to the table. We've been talking all along. But while he wants to do all this, I'm like, honey, you still have to heal. Yeah.
So you just went back to work. But I think in the January, beginning of February, I'm like, okay, so
let's dream with our eyes open, baby.
Yeah, so it's like, okay, now I can most times sleep through the night and don't have to get up and like watch him breathe and I hear breathing or
that's love.
So now it's like we're at the stage where Like I said, it was 5 months yesterday, that he's been out, that, we're able to kind of take it to the next level. And I think the summertime will just give us a lot more space and grace. People want to come out, they want to learn it. And because when it happens, we talked to some top cardiologists here. He got the best care, but they're like, even people that know CPR, and when it happens at home, people are scared to touch their loved one in that space. And, am I going to hurt them? Because, sometimes you do crack ribs. I'm just being real. Things do. It's not a pretty thing.
Right.
And some people can't handle that, even if they know CPR. So they said, like, usually a home cardiac arrest like that, only like 1 out of 10 survive. And even if they survive, they have a lot of deficits after because of the lack of blood to the brain. So then there's a lot of, maybe some traumatic brain injury, there's some cognitive deficits, some physical deficits. But I didn't have any of that, and it was because of, the quick response, but also, our neighbor came right over and helped. And then, he called the cavalry in, and the house was filled with like 30, 40 people, and it was a little overwhelming, but
that's love.
I went into autopilot, and I'm calling like every doctor I knew, all our friends, like, please make sure he gets the best. So he got the best care. So when everybody looked at the totality of everything that happened, they were like, it was the perfect set of events. Mm-hmm. So if one thing didn't happen, he would have been here.
I want to know about your role on the advisory board for emerging leaders. So, like,
oh my God.
What is that like for you, and why did you decide to put your hand in selecting the next emerging leaders and advising that process?
Yeah. Well, so after our class, I think it was after our class, they kind of like, we need to revamp the program because it was during COVID. So, you had to adapt to certain things. Yeah. And it's like, okay, what does it look like post-COVID? So I was asked and humbly accepted. And I was like, oh my God, really? I didn't know I added that much, but I was like, maybe my mouth, just kept going. Just being able to be part of revamping, adding different context, adding, because there's already an excellent program, but just giving especially like a post-COVID perspective on things and what's going on in the community as it is. And then knowing what it takes to be a leader.
Yeah.
We
read your intro.
Know what it takes to be a leader. Like, I was a leader in healthcare, but then when in community, healthcare is community, but this is like, it's all prescribed. You're in the hospital, you're in a clinic, you're in, community is you're going to the people where they live, where they sleep, where they work, where they pray, all that.
It's a road game. The hospital is home court advantage.
Yes, absolutely, because you're coming on your turf. Yeah. So now you're on their turf, and it's like it's a different ball game, and you have to show up as your authentic self and meet people where they're at, and to help them get to where they want to be, not where we want them to be, where they want themselves, where they see themselves to be. And in that quest, they're finding the best version of themselves. And whatever resources we can pull, that they need, all driven by them. I don't believe in telling people what they should have or what they should do. What do you want? Ask questions, be curious. And then, okay, how can we navigate this? What tools do you already have? Because we're coming from a strength-based. What tools do you already have, and what can we add to get you to where you need to be? So that's where it's kind of like, very, very passionate about that. Like I can talk for hours about that. I don't even know if we have that kind of time, because I think that's the biggest piece. Just like with you, you were able to find who you were. Yeah. Through trying things that you didn't like.
Absolutely.
Dressing up 9 to 5 and, business suit and all that, business casual. That wasn't your thing. But you would not have known that had you not gone down that path.
Exactly.
Right? So sometimes when we, do make, I don't even like to say mistakes. I like to say there are opportunities for improvement or professional development or personal development. When those opportunities occur, listen to them.
Yes.
I say listen to them. Sometimes it hurts. Sometimes it comes with heartache. Sometimes it's like, I don't understand why this is happening. But I tell people, listen to it, because there's a lesson in every single interaction. Well, we may say, I don't even like to say good or bad, but there's a lesson in every interaction that we have. And if we take the time to be quiet, be still, and listen to it, we will learn from it.
Buffalo, what has your experience been like as an emerging leader and as an alumni? I know that's a loaded question, but feel free to take whichever part, however much time we need. So you feel free to take whichever part of that question that you want.
Okay, so long path. I think like going back to generational. My mom, my aunts, my uncles have always been in community. They've just been real quiet about it, but always in community, doing something, providing something, and giving back. And because so much has been given to them, and they we feel so blessed. It's like you can only do so much and buy so much. You have to give back. You have to put that seed in someone else and be able to, you can do it too. And especially when they know your story. Right. I grew up in the town gardens, and, it's wonderful to be able to come back and say, okay, you can do this too. And you may have experienced all these things I did too, and this is how I navigated it. So it helps inspire people. So the foundation was already there. But I went to school to become a nurse. Initially, I was going to become a doctor and join the military. Life happened, so instead I became a nurse, which I'm so happy that I did.
That's interesting.
Nothing against doctors, because I'm married to one, love them all. A lot of friends that are, but became a nurse, and I did join the military and did nursing for few years, I'll say. I still say I'm 21, but I did nursing for about 20 years. And, had realized, we're taking care of people's bodies and healing them, but the mental and emotional aspect may not have been as at the forefront as it probably should have been. So people were still having issues. And sometimes, especially like if you're in an emergency room, they're coming in with panic attacks, anxiety attacks. It's like, what are we missing here? So initially I was going to go to medical school, but I was like, God bless all the doctors. But I was like, I do not have 4 years for med school, 4 years for residency. I was like, that's 8 years.
That's some time.
Yeah. And so I said, nurse practitioner school is amazing, and I would still be able to do the same thing. And I didn't need the title of doctor. So I still am able to prescribe, diagnose, and do counseling as well. So went to Duville, which is Duville University.
That's right. I went to Duville too. Yeah.
Yeah, I love
proud it. Duville grad.
Yes, very proud. And got a great discount because I was a veteran. So I was paying like undergrads pay. So I was like, I can do this. And
shout out to DYU now.
Yeah, I know. Sometimes I slip up, so I'm sorry, Duville. Duville College, but now Duville.
I mean, my degree say college still.
Mine does too.
They wanted me to pay $35 for it to say university, and I was like, I love y'all, and I appreciate y'all, and I appreciate the award that y'all gave me recently. Shout out to my professors.
Yay.
But I went to Duville College, not university, so I'm not happy with what my degree says.
And it gives you a little historical.
It does.
Like I was here when it was the original. So I can do that. Yeah. So did that, and then the last semester of. Before I was supposed to graduate, I got a call from the Buffalo Urban League, and they had asked me to help them kind of get some resumes going for this program called New York Project Hope.
Okay.
And I was like, sure. A lot of people. Yeah. So I think probably in a few hours, got them about 7 resumes. They were like, oh my. So, and then I threw my hat in there because it was supposed to be a short-term program. It was a FEMA grant. And, FEMA only comes into play when there's a disaster of some sort, and it's usually short-term. So I was like, okay, it'll end in 3 to 6 months. I graduate in May. It takes time to get what they call it, the permission to test for your authorization to test for your board. So I'm like, well, I can study it. That'll be good. So I put myself in as or submitted my resume as a part-time crisis counselor. But after the interviews were done, they were like, no, we want you to run this program. I was like, I've got school. I was like, I have all the sweat, blood, and tears, money that I'm like, I have 3 more months to go. Like, I don't know if I can do that.
Not years, months.
Yeah. So I was like, and it was a long 2-3 years.
I'm trying to finish strong here.
And I was like, I don't know if I can put that off, but Miss Grace Tate was very consistent.
I love Miss Grace.
She is amazing. She was, she played chess and won. And so she always gets what you want. So I said, okay, sure, I'll come on board. And they kind of worked with my schedule a little bit. So that first month, I started in February. That first month, I was doing a lot of training with SAMHSA and Office of Mental Health, and then started the hiring process. So we ended up with a team of like 21 individuals.
Oh.
And we're providing, they call it, we follow the SAMHSA crisis counseling model. So there's a crisis counseling model that, there's a continuum of, the different stages. So we followed that, and significant amount of training, which was great. We were very excited to make sure we had a very diverse team of like 7 different languages, cultures, young, old, LGBTQ, like everything we could think of, because we were stationed at 1021 Broadway. So we wanted to make sure that the services we were providing was going to be from the providers would be reflective of the people we're serving. So it was very intentional, very deliberate to make sure we had from Asian to Bengali, you name it, we had it. And so we were providing emotional and mental health supports for anyone in Erie County that was affected by COVID. It started out with COVID.
Oh, wow.
And remember, our numbers were really, really high. Yeah. So people were struggling, with loss, isolation, and things like that. So we provided those services, and we, anybody that was breathing and walking, we were providing those services for. So seniors to youth and everybody in between, and then, every sector you can think of. And we tried different ways of doing it, and it was quite effective. Quite effective, yeah. And I don't believe in we're patting myself on the back, but when you hear from other people that you're providing those services for and you're supporting, when you hear their feedback, that's the litmus for me that we're doing the right thing. And so, the team was very excited to do the work. And very intentional in making sure their mental health was intact, because the work is hard, as you know.
Yeah,
the work is hard.
A lot of us are wounded healers.
Wounded healers, yeah. Mm-hmm. But through the healing, that's where I feel like I can speak for myself, where you get healing something.
Yeah.
Because you got to walk the talk. Yeah. You can't say, you got to do A, B, and C, and then you turn around like, you got to walk the same talk. So you kind of get something out of it. So we were, doing our thing with COVID and helping the community, whether we were in schools, community centers, wherever. And then TOPS happened. And we were there front and center in the red coats. People probably remember us in the red coats, because I was like, I got to make sure I can keep an eye on everybody and all the crowds. There were so many people from all over the world there. Yeah. And we were providing crisis counseling, if you will. And remember I talked about the model and the continuum. So we were coming not towards the end, but almost towards the end of COVID. And now we were shifted back to the very beginning with the 514, which is very different than, we're teaching, internal coping strategies and giving referrals. And now you're at the very beginning where people just need a hug.
Right.
They just need you to be quiet, be there, hug, feed them.
Be present so they're not alone.
And so it was, and then we're dealing with our own stuff, because we grew up in these communities. Yep. We live, work, pray, praise and everything. So it was a very hard time. I definitely will say that, very hard time. And in the midst of all this, Miss Grace has said, I think you would be a good fit for the emerging leaders at Open Buffalo. And I'm like, oh, what? Because by this point, not only had I taken my boards. Okay. Not only had this FEMA grant that I thought was going to be like 3 to 6 months got extended to almost 2 years. Right. Because we did so well. But I was also working at Best Up. Wow. Like 1 or 2 days a week, because I'm like, I went to school for this.
Yeah, I want to use what I went to school for. I feel you on.
Sleep optional.
I'm with you. I hear you. I live that way now.
Yeah, I know, right? I get it when the body exhausts itself. No, that's not healthy. Let me pull that back. Got to get your sleep, because it will exacerbate or cause things that are not good. Amen. So I applied because Miss Grace said so, and I'm glad that I did, because, at first I thought, like, I'm doing a lot of this stuff already, because even in healthcare, I was a leader and now in the nonprofit sector, I was a program director at the time. So still a leader, but not at the level that I was used to being in healthcare itself. So, always something to learn. And I really enjoyed the program.
Wow.
And, growing up in Town Gardens, growing up, thinking that how bad it is, but then really getting hardcore statistics and really getting different perspectives. And so the speakers that were bringing in, I think it was Dr. Henry, they brought in, it was just like, oh, we got to fight. We have to advocate. It's like it just put this fire inside of me that was already there, but it really made it just like wildfire.
Pour some gas on.
Yeah, because it was like, not only we have to do this quickly, and then we need to get this younger generation as young as they can understand and start pouring into them so that we can pass the torch off and quick.
What would you say as somebody who's been through the program and as an advisor to somebody who was on the fence about considering applying, or somebody who's currently in the program, depending on when they watch the video?
Right. So I think that even if you're on the fence or you have applied or you're excited about applying, you cannot go wrong doing this program. And you're going to learn so much. You're going to learn different perspectives, different thoughts, things that are going to challenge you, that are going to make you question things. And it's going to make you, and you will come out the other end wanting to be unapologetically savage about fighting for your community. And that is it right there. Unapologetically. Right? And doing what's right. And what do you say? Get into some good trouble. I love that phrase. Yes, get into some good trouble.
I'm all about some good trouble.
Yeah, because at the end of the day, whether you are, wherever people are in their life, don't you want to make the community that you're living in and any community that you're living in better?
So I hope you enjoyed this conversation. I know I have.
Thank you so much.
Don't expect all these episodes to be this long. This was the first one, but we couldn't have had a better guest. It's been a privilege to reconnect with you and have this kind of a conversation with you.
Yeah.
I know we've spoken a lot and we've been in contact, but to just really sit down and just pick your brain and get to know you a little bit better. It's been super awesome. Like I said, you're one half of one of my favorite couples in the city. So we want you folks to share this video with folks. If you enjoyed it, get in the comments. Let us know what you think. We want our emerging leaders, alumni, and family to get in the comments, share your stories. If you want to be on one of these episodes, make sure you hit up Leslie. Hit up Leslie Nickerson over at Open Buffalo.
Yes.
To be featured in the next episode of the Open Buffalo Alumni Spotlight. I am your host, Sherman Webb Middlebrooks, lifelong Buffalo resident and full-time Black man. With Melissa Archer.
Thank you for having me.
Of course. And anytime you want to come back, anytime you want to produce anything, you just let me know.
Oh, we will.
Yeah, most definitely.
Send me that contract.
I most certainly will. So in the words of my hero, the Honorable Jerry Springer, y'all take care of yourselves and each other. Peace.
Peace. Jerry Springer Trainer.
He's my hero.
He's crazy. I love it.
Yeah.
He was a serious reporter.
Yeah, in the mayor of Cincinnati before.
Yeah, and then he went, and I'm like,